of course, the European Union and the German EU presidency for bringing us all together today. My name is Ryan Heath. I'm a Belgian Australian, and I'm in charge of the Global Translations newsletter and podcast at Politico. And that means my passion is making sure that we are always talking and learning and cooperating with each other. And that's what I hope we do at this event today. Before we get started, I would like to make sure that you keep your video on if possible, but your microphone's muted unless you're talking. And wherever it is in the world that you're joining us, good morning, good afternoon, or good evening. We really appreciate you taking the time to be here. We're going to start with statements from our organizers before we open it up into more of a global discussion, including the chance for you to ask questions. The first element of the event, we'll get right into it, is a short video, followed by opening statements from EU Ambassador Olaf Skog and German Ambassador Christoph Huchsen. So let's get straight into this video. Ambassador Skog, the floor is yours.
Thank you very much, Ryan, and Excellencies, dear friends, colleagues, thank you for joining us today. In the context of the UN General Assembly special session on the COVID-19 pandemic, I have the great pleasure to welcome you all to this event dedicated to the Team Europe global response to the pandemic. I'd like to welcome in particular Ms. Antje Lendertse, State Secretary for Foreign Affairs of the Federal Republic of Germany, Mr. Felix Fernandez Shaw, Director for International Cooperation and Development Policy at the European Commission, as well as my dear friends and colleagues from Kenya and El Salvador, of course, the International Committee of the Red Cross, various UN colleagues, and the World Health Organizations. Colleagues, apart from the horrific toll on human life and devastating blows to societies and economies across the globe, the pandemic has also laid bare how connected we all are to each other. For better or for worse, we are all in this together. The health of someone on the other side of the globe affects our own health. When we stop traveling, countries on the other side of the globe risk bankruptcy. So there is no contradiction between taking care of our own citizens and caring for the citizens of the world, because we're all connected. It's all connected. Europe had to act quickly and in a joined up way. The European Union and its member states, together with the European Investment Bank, the European Bank for Reconstruction and Development, have joined forces and acted as Team Europe. The amounts which were mobilized in a couple of months are considerable. Under the Team Europe umbrella, we have a combined financial package of more than 39 billion euros. And all with a view to supporting partners in overcoming urgent health needs, mitigating the multiple humanitarian, social, and economic impacts of the pandemic, while, of course, upholding human rights, democracy, good governance, and the rule of law. We've been delivering a range of programs prepared and implemented in cooperation with partner countries. And in the course of today's events, some examples will be provided. In the same spirit of solidarity, multilateralism, and of course, enlightened self-interest, the EU and its member states have been working hard for a fair and equitable global access to safe, affordable, and effective vaccines. therapeutics and diagnostics against COVID-19. We've been defending the Build Back Better vision of resilient health systems and of a sustainable and fair recovery. So I hope that this session answers the questions that you may have on Team Europe in an interactive and inspiring way. And let me hand over first to my colleague and friend, Christoph Heuskens, Ambassador of Germany to the United Nations. Christoph.
Yes, thank you. Thank you very much, Ryan. Thank you very much, Olaf. It's wonderful to organize this event together between the European Union and Germany, between the presidency, and the European Union, and here between our mission and the EU delegation. And thank you very much from my side for this good cooperation. We are almost at the end of the German presidency in the EU, which actually is time-wise the same time as the end of our membership in the Security Council. And we, I think, are it's very clear that both for our EU presidency, but also for our membership in the Security Council, the COVID pandemic had the most impact on all of us. It's the biggest test for our generation, and it is a very serious challenge to our multilateral system. And Olaf, you already mentioned the UN General Assembly special session last week. That was a clear reminder to all of us that multilateral approaches are the only solution to overcoming this crisis. And the call for international cooperation was very strong, although we have to admit not shared by everybody. But overall, the UN special session confirmed multilateralism is the key to success. It works, but of course it has to be supported globally. And I think we can proudly say that from the beginning, it is clear from the beginning of the pandemic that multilateral cooperation has proven its value. And acting as Team Europe, the European Union, its institutions, its member states have assumed responsibility as a strong and solidary partner. During our EU presidency, we have been determined to pursue this leadership with strong solidarity, both at home in Europe and through strengthening the multilateral system. From supporting efforts to halt the spread of COVID-19 and helping partner countries to strengthen healthcare, water and sanitation systems, to ensuring a fair global distribution of vaccine as global public good, and to strengthening the global health structure. The EU and its member states stand at the core of relevant multilateral efforts. So I'm looking forward to today's exchange. There has never been a stronger need to work together as the world globally as a team. And the action and solutions we implement today must also help to build back better. Team Europe promotes an equitable, sustainable and inclusive recovery. Acting together now, we can emerge stronger tomorrow. Thanks very much, and back to you, Ryan.
Thank you so much, ambassadors. It's now time for our keynote statements from the German State Secretary of the Federal Foreign Office, Antje Lehndratzer, and from Felix Fernandez-Schor, who's the European Commission's Director for International Cooperation and Development. State Secretary, the floor is now yours.
Thank you, Ryan, and good morning to New York from Berlin. I would also like to thank, of course, the EU delegation in New York and all contributors for organizing this event, which is, I think, timely and also well advised to do it in the margins of the special session of the United Nations General Assembly last week, with the participation of many heads of states and governments, including the Federal Chancellor. So, Excellencies, colleagues, Olaf Skog said it, we are all in this together, and COVID-19 affects us all. So it is obvious that this global and multi-layered crisis can only be overcome by joining our efforts regionally, as in Team Europe, and globally as in outreach of the Team Europe. The EU and its member states are strongly committed to multilateralism. This has been said as well. International cooperation, responsibility, and solidarity are guiding the EU global response to COVID-19. When taking over the presidency in July, Germany placed crisis management and sustainable recovery from the heavy socioeconomic impacts of the pandemic at the center of its agenda. And the EU and its member states, acting together as Team Europe, are taking comprehensive and decisive action to tackle the destructive impact of COVID-19. The measures aim at mitigating the multifaceted urgent health, social, economic, humanitarian, security, and political impacts of the COVID-19 pandemic, while upholding human rights, democracy, good governance, and the rule of law. And with the latter part, I, of course, echo the words of the Secretary General of the United Nations. As a whole, I think that this crisis showed that the implementing the SDGs, and not only the SDG 3, is really also crucial in overcoming the crisis. Since its launch in early April, Team Europe has mobilized almost 39 billion euros. We have seen this in the short video clip we've seen in the beginning, to address the effects of the COVID-19 crisis in partner countries and regions. And I very much look forward to seeing some concrete project examples later on. The idea of international solidarity is also at the heart of European vaccine policy. No one is safe until everybody is safe. Recent advances by the BioNTech and Pfizer partners, as well as many others, give us hope, of course, that now the vaccines will change the situation and could indeed be available soon. But this is only a first step, having an effective vaccine. Its timely, fair global distribution as a global public good will be crucial. The EU and its member states stand at the core of relevant multilateral efforts. The access to COVID-19 Tools Accelerator, or shortly abbreviated ACT-A, and its vaccine distribution pillar, COVAX, will enable many countries to coordinate and enable vaccine procurement either for themselves or by providing vaccines to low and middle income countries. EU member states have committed themselves to ACT-A and work together with the European Commission within the initiative. Europe is the biggest donor within ACT-A. Shaping a fair vaccine policy has been an unprecedented exercise, and the EU has been co-leading it. I'm very happy to have Bruce Aylward with us today, who will share more insights on ACT-A during the panel discussion. While the fight against COVID-19 is not free from strong national instincts, and everybody, I mean, around the globe is a big witness to this, we hope to see more and more countries concluding that only multilateral cooperation in the end will enable us to overcome it. I hope that we will see powers such as the United States and China among them fully embracing this approach and their responsibility. Amid these pressing tasks, we must not lose out of sight the need to strengthen overall the health systems, SDG 3, and especially in developing countries. Team Europe is committed to improving global health architecture beyond the immediate crisis response, making it more resilient to future health risks. The WHO is the leading and coordinating authority for global health within the multilateral system. But the pandemic has shown us quite plainly, the member states' expectations of WHO exceed its capacities that have been provided by the member states of WHO, both legal, personnel, and financial by far. The EU is a firm supporter of the WHO reform processes. During our presidency, we have advocated for the EU to take a leadership role in global health. The EU had already done so at the World Health Assembly in May 2020 in initiating and negotiating the WHO's resolution on the COVID-19 response. We have made concrete proposals on how to strengthen the resilience of national health systems. I name a few: the adaptation of the international health regulations, the implementation of periodic review mechanisms, establishing a traffic light system for health crises, and anchoring the One Health approach at global level. We are particularly pleased in this regard that the EU-led discussions in Geneva on strengthening WHO are beginning to bear fruit. We believe this is the moment to join our efforts to strengthen WHO structurally and financially so it can fulfill its global health mandate. In the future, WHO needs to be better prepared, even better. We said so after the Ebola crisis, and we made a step forward. And I think this is a unique chance to show that cooperation trumps isolated national action and to go out of this crisis again better prepared for the next. The EU is fully committed to its multilateral responsibility. When we succeed, which I am sure of, we will have the clearest evidence and testimony that multilateralism is the only meaningful way to get through these difficult times and to build a future that leaves no one behind. The SDG quotation that never has to be missed. So thank you for your attention, and over to Ryan again. Thank you.
Thank you so much, State Secretary. Those are very important words, and we really appreciate them. Now, the man who might be able to answer some of your more detailed questions is the European Commission's Felix Fernandez-Shaw. Felix, take it away.
Hi, Ryan. Hello, Olaf, colleagues, State Secretary, German Ambassador, all the colleagues. It's really a nice and indeed memorable event for a director in charge of bringing the member states together and talking multilateralism to do a second event in the same year with the UN on the reply and the response to COVID. When we started working against the pandemic back in March 2020, the first thing we thought here in Brussels, and I must really recognize the role of some member states like Germany, who came very quickly to tell us, listen, we cannot do business as usual. It cannot be all the Europeans quickly running around trying to solve stuff and support partner countries and support UN member states on their own. We need to do this together, because it's only together that we're going to have a bit of impact. The first thing that crossed our mind, I think the State Secretary has said it very well, is of course, let's work not only together with the European Union member states, but also let's work together with the international organizations and the multilaterals. And we quickly organized and supported 2 international pledging conferences on vaccines, raising almost 16 billion euros of euros to develop and ensure equitable access to coronavirus vaccines, tests, and treatments. And the Team Europe part of those 16 billion was almost 12. Additionally, I think we've also increased our support to COVAX to 500 million for vaccines for low and middle income countries. And this is all brought together by the Europeans, Team Europe, which is really trying to support everyone in the world. I think Olaf said very well, but also Ambassador Huysgens, if you don't do it together and you don't fight together with the pandemic, you're basically lost. But of course, it's not only about health that we wanted to do, because the pandemic has brought an incredible and massive stop all over the world. For the first time in our life, it's been unprecedented, the way in which everything has stopped. And Team Europe tried to reply to this by mobilizing substantial financial resources. For example, in Bangladesh, together with Germany, we have supported direct cash transfers to vulnerable households to reduce the spread of the virus in urban areas of Dhaka. In Kenya, Team Europe mobilized more than 500 million euro, including 65 million euro grants in social safety, safe trade and budget support, but also opening access to finance to small and medium enterprises, knowing, as we know in Europe, that not only are these the blood of the economy, but they are also very heavily targeted by the socio-economic impact of COVID. We also have worked in Mali, we've worked in El Salvador. I think we'll hear some interesting remarks now. In Jordan, I mean, I think we have presence in the whole world. And in the whole world, for example, as in Mali, more than half of the Team Europe response, which amounts to 140 million, has already been dispersed. And there we are, the European Union institutions and more than seven member states working together. But this is, I think, the presentation we did in June, thanks to Olof and his team. We were able to present to the UN membership these ideas and this project and this operation. We're very happy to say that 6 months down the line, more than half of what we pledged to do in June has already been dispersed. That amounts to 19 billion euros already dispersed of support against COVID in the world. Now, of course, we also need to look a bit further, and in the context of what the UN Secretary General called the high-level event on financing for development against COVID-19 and beyond, we need to start looking together and how we're going to recover. And President von der Leyen President of the European Commission von der Leyen opened the UN high-level event in May 28th, when she said that we needed a global recovery initiative that links debt relief and investment to the SDGs, to the Sustainable Development Goals. So we need to work on this financing for development better. We need to work on mobilizing investments. We need to work on planning. We need to, this crisis is a very good opportunity to pick up some of the old words in the Addis Ababa Action Agenda and in the Agenda 2030. We need to plan how to prioritize financial resources. We in the European Union are ready to work together with UN member states on how to mobilize investments and how to bring those investments where they're most needed, but also how to bring those investments in order that they push new policies, innovative policies, policies that are aligned with the SDGs and with the Paris Agreement, policies that fight against inequalities. For example, on digitalization, the fact that we all access today via iPad means that we are connected and we are digi-alphabetized. This does not happen all over the world, and if we don't push access and digital literacy and skills, there will be more inequalities, not less. And this is what we wanted to present to you today, is the fact that we are now promoting not only Team Europe against COVID, but we are enlarging Team Europe initiatives together with member states to bring new concepts, but also new push and new and better, larger investments in the rest of the world by bringing together what the Europeans do, what we know, our funding, our expertise and our knowledge, but also our technology and our investment to help support systemic changes, to help support transformative impact, but also to abide by transparency, accountability, sustainability, effectiveness, and results. I'm very happy to be here today, Ryan, and I'm of course ready to try to reply to all those questions, even if you already placed a heavy burden on me at the very beginning. Thanks a lot.
I apologize for that, Felix. But yes, Felix has agreed to stick around for our panel, so do get those questions ready. Before we introduce that panel, we've got another 2 short videos which will show us a bit more about what Team Europe has been doing in conflict-affected areas and also El Salvador. So let's bring those videos up now. And it's now time to introduce our panelists. We're so grateful that they've come to join us. We've got Kenyan Ambassador Martin Kimani, El Salvadorian Ambassador Griselda Lopez, WHO Senior Advisor Bruce Elwood, Letitia Courtois from the Red Cross, and the UN Assistant Secretary General for Policy Coordination and Interagency Affairs, Francesca Spato-Lizano. Each speaker has got 5 minutes. I'm going to be equal opportunity disciplinarian, and I'm going to make sure we stick to that time so that we get through this packed program. Ambassador Kimani, the floor is yours. Over to you, Ambassador Kimani.
Thank you. I hope you can hear me clearly.
Yes, we can. Go ahead.
Okay. Your Excellency, State Secretary Lendatsa, and Mr. Fernandez Shaw, and the ambassadors who have spoken and will speak later, greetings to you, and it's a pleasure to be here with you. It's a privilege to join you for this session, and I thank Germany and the EU delegation for hosting us for this important event. I wholeheartedly embrace the remarks by Your Excellency, Madam State Secretary. Your clarity on the multilateral moment and your commitment to grasping it is to your great credit and a credit to your country and to the European Union. It is not news that this pandemic and its health, economic, and social effects is causing historic damage to every country. I think what is new is how our community of nations will utilize the tools of multilateralism and the United Nations in delivering effective and inclusive solutions. And I think the world and its people are looking and noting how we in the institutions respond. They have established these institutions and fund them for this precise moment of crisis. In regard to Kenya, we're working hard to limit the damage. To date, we have over 89,000 cases, and unfortunately, just over 1,500 Kenyans have succumbed to the disease. We are working very hard across a range within government and the private sector to deal with the pandemic's impact on our economy, livelihood, and jobs. And this comes at an unwelcome time when the demand for expanding employment to provide for our young population is great. In terms of the response of our government, perhaps I can get into that some other time, but given the limits of time, let me go straight to the important points for this specific session. I applaud Team Europe and its response to the pandemic. And we in Kenya have had very significant support from this effort, as mentioned by Mr. Fernandez Shaw. And I commend the effort not only for the resources it's providing, but the innovation and the openness to innovation that it has shown. The EU delegation in Kenya has been a strong partner in thinking with the Kenyan government on how to deliver assistance that is most impactful where it's needed the most. We thank the European Union for this solidarity. And we think, Excellencies, the key to a global recovery is solidarity and multilateralism. And everywhere we see there are pressing challenges that require multilateralism, and the response to the pandemic through multilateralism is going to show the way on how we can actually tackle problems going forward. Unfortunately, well, sir, that is 3 minutes and 30 seconds, unless your timing is different.
I simply thought you'd ended. I will go back into my box. Continue, please.
Good. I think that earns me an extra 30 seconds. Thank you. Anyway, the key point is that there's an emerging dynamic where the richest countries are first in line in getting access to the vaccine. There's solidarity in dealing with the COVID and coping with it, but in terms of eradicating it and access to the vaccine, there is an emerging dynamic where the poorest countries are not in line to get access to the vaccine. I very much welcome the remarks by the State Secretary on the work being undertaken to correct what I think would be a historic mistake. I invite all members of this forum to consider the effect of a hierarchy on vaccine equity and how the effect will not only undermine the global response to the COVID-19, but also undermine multilateralism itself. We welcome a different direction, with every effort being undertaken to ensure COVID vaccine equity as a cornerstone of the global response to the pandemic. Kenya applauds the countries, companies, and civil society groups that are working to make this happen. We stand ready to work with you, not only in terms of providing the vaccine to Kenya, but to all countries in the global South and Africa. Your Excellencies, in conclusion, the road to building back better demands vaccine access for the entire world. We must have a green and blue COVID-19 recovery that stands on the shoulders of equality and multilateralism. I thank you.
Thank you, Ambassador. And my apologies for interrupting you. I was just enthusiastic about your words on the innovation in the way that we're responding. That really struck home with me, and I'm glad to hear that you see the EU as doing that. Ambassador Lopez, please take it away.
Thank you, Ryan, and all protocols observed. At the outset, let me express my gratitude to the European Union for inviting El Salvador to participate in this side event, and to the keynote speakers for their important messages. For El Salvador, this pandemic is not only a health crisis, it has hardly hit our economy, and its social effects are devastating. Since the government of President Nayib Bukele took office, one of his priorities was to strengthen the national health system, expanding health services coverage, improving access and quality, with the objective to fulfilling the provision in our national legislation that everyone has the right to health, which is understood as the enjoyment of the highest level of physical, mental, and social well-being. COVID-19 pandemic is deepening gender inequalities, both inside and outside homes. Data from the Latin American region shows a greater vulnerability to gender-based violence, which is exacerbated by confinement and by limited access of women to public services for the care, prevention, and punishment of violence, which in many cases are not considered essentials. Furthermore, access to basic services, including sexual and reproductive health care, is being limited, further exacerbating existing inequalities. But children also have been victims of this pandemic, facing an increased risk of exploitation, violence, and abuse. In this context, I would like to recognize the invaluable assistance that the EU has been providing to El Salvador to fight and prevent the COVID-19 spread through different programs. And I will just name a few. The Spotlight Initiative to eliminate femicide and sexual violence against women and girls. The support of €6 million to financial sector for micro, small, and medium enterprises affected by the COVID-19. €3 million have been oriented to support our social plan, and €10 million for a project on economic empowerment of women and vulnerable families. and over €1,100 for the provision of sanitation and hygiene kits and biosecurity packages for women and basic food basket. Additionally, and due to our vulnerability to climate change, El Salvador suffered the impacts of several tropical storms while fighting the COVID-19 pandemic. In May and June, our country was struck by the storms Amanda and Cristobal, and most recently, Eta and Iota. This was a reminder that any recovery plan from the pandemic should aim for recovery better, sustainably, and inclusively. I wanted to highlight this since the COVID-19 pandemic. Amid that pandemic, the European Union continues supporting our region to restore ecosystem and landscape through a comprehensive cooperation program with the Central American Integration System, SICA. Dear friends, health is essential, and its effective and quality access must be guaranteed to all people. Therefore, timely and equitable access to a vaccine must be the central issue that defines the current international agenda. In this regard, we recognize WHO's role during this pandemic response and recovery progress. For El Salvador, the availability of an effective and accessible vaccine against COVID-19 is a priority, which must be conceived as a global public good. We commend the work of Team Europe and invite more countries and other potential donors to support developing countries' initiatives, including middle-income countries, to contain the COVID-19 pandemic. We agree the call of Felix Fernandez to work on financing for development, to promote investment, to benefit the most needed, to innovate and to prioritize financial resources in line with the 2030 Agenda, meaning the SDGs, the Addis Ababa Action Agenda, and the Paris Climate Agreement. To conclude, I would like to recall that this pandemic has not distinguished between nationality, race, sex, ethnicity, migration status, sexual orientation, and gender identity. However, it has disproportionately affected those who cannot have free and secure access to health systems, which frequently also have conditions of pre-existing vulnerabilities. That is why I echo the call to working together. We will overcome this pandemic and future pandemics only with solidarity, and multilateralism in this sense should prevail today more than ever. As stronger together. Juntos somos más fuertes. I thank you.
Thank you so much, Ambassador Lopez. It's now time to turn to the World Health Organization and Bruce Elwood, who's Senior Advisor to the Director General for Organizational Change. Now, we know the EU is a big funder of the ACT Accelerator, but we also know that it needs at least $20 billion more to fulfill its potential. Bruce, tell us more about what the latest is and what are the next steps.
Thank you very much, and thanks so much for the opportunity to be part of the conversation. I've really enjoyed what I've heard so far. But if I might jump right in and say a few words about what the ACT Accelerator is, how it functions, and where we are. The ACT Accelerator was conceived, and Europe played such a big part in this. In fact, the president of the EU, the European Commission rather, was part of the quadrumvirate, is that what you call it, of 4 people who launched this very, very innovative initiative in April of this year, on the 24th of April. So on the 24th of April, President von der Leyen, along with President Macron and the Bill and Melinda Gates Foundation, joined the Director General of WHO to launch the ACT Accelerator. And ACT stands for Access to COVID Tools. It was clear already to our leaders back in April that we were not going to be successful without a broader set of tools that could actually be used globally. So the big idea behind the ACT Accelerator was to take our decades of investments in the global health architecture, in Gavi, in the Global Fund, in WHO, in the other agencies, and repurpose them basically in the short term to be able to, number one, accelerate the development of the drugs, the vaccines, and the diagnostics that we need to be successful in against COVID, But number two, and as essentially as has come up again and again in this conversation, ensure their equitable access. Unless everyone can access these tools at the same time, we all lose. It's not just the right thing to do morally, it's the essential thing to do also economically. And that's what the ACT Accelerator is all about. So where are we 6 months after this idea came to light? We have, number one, new rapid diagnostics that we know work, and we have an agreement for hundreds of millions of these at reduced prices for low-income countries to guarantee access. We have the new COVAX facility, a facility that brings together 189 countries to collaborate on the procurement of COVAX vaccines, new vaccines against this disease, and also to be able to ensure their equitable rollout. We have the first therapeutic, dexamethasone, that we know can save lives against this disease, the only proven one to truly save lives. So, and we also have the broadest portfolio of vaccines in the world. So within 6 months, and really, and we have to again express gratitude to Team Europe for really getting behind the initiative that is the ACT Accelerator. We've been able to repurpose the international architecture to make massive progress in the accelerated development of these products. And now we're on the verge of being able to roll them out to be able to be successful in changing the dynamic of this outbreak. The critical problem right now are two, and they both come down to political choices. The first one, to fully finance the ACT Accelerator. If we do not have the $20 billion that you just mentioned, we cannot procure these products, we cannot roll them out, and we cannot get the world out of this crisis. It's as simple as this. This is a lot of money, but it's a fantastic deal. The cost of the ACT Accelerator will be recouped within 36 hours once international travel and trade and mobility have been resumed. And this is a critical piece of the solution to getting there. So it is a great deal. The second political choice we have to make is to make sure that the people, our vital infrastructure, our vital healthcare workers are the first ones to get these products, along with the older people in our societies who are at risk of the most severe disease, because that is the key to taking the pressure off our health systems, to allowing us to get our societies back to normal and to get our economies back to normal. We've got to reduce the risk of severe disease and the fear of this disease. That requires protecting those at highest risk of the severe disease first, and we live in an interconnected world. We have got to do this together globally if we're going to come out of this together. Even if you are a hardcore Grinch as we enter, or Ebenezer Scrooge, right, as we enter into the holiday season for Christians and others around the world, you know, we need to remember, if you want to be successful, even if it's a hard-hearted, you know, economic side, the only way to do it is by sharing these products. The ACT Accelerator has accelerated the products, and it's created the mechanisms to ensure we can get out of this together. And to the theme that's come up again and again, this is an extremely innovative approach that's being tried, and again, with the support of Team Europe and really all countries, industries, civil society, academics, but especially the 9 agencies that are at the center of the ACT Accelerator, the Gavis, the Global Funds, the FINES, et cetera. But the opportunity is there, and what we really need now is the financing, or we're going to, you know, we have this great expression in English, we are going to snatch defeat instead of victory from the jaws here. The opportunity is fantastic. And again, thanks for the opportunity to be part of this conversation. Hopefully that brings to life a little bit what the accelerator is, where we are, and the reality that this is the solution, the global solution to getting us out of this crisis. And again, thanks to Team Europe for the genius that was behind joining forces with WHO, President Macron of France, and the Gates Foundation in the initial launch of an initiative that now involves almost every country in the world, every relevant industry, CSOs, and others who will be essential to its success.
Thank you, Bruce. And what an extraordinary reminder you've just given us of the fact that we've now spent, as the world, more than $11 trillion on fiscal stimulus, the Band-Aid to all of these problems, and that the solution itself just takes that 20 or so billion dollars or euros. I think it's a
absolutely
really message.
Less than 1% of that stimulus would get us out of this crisis if it were applied to the Act
That
Accelerator.
is my number one takeaway. Absolutely. Thank you so much. Now it's time to hear from Laetitia Courtois, who heads the UN delegation of the International Committee of the Red Cross. Over to you, Laetitia.
Thank you very much, Ryan, and thank you very much for inviting us into joining this impressive panel and interventions. I would like just to first of all mention that the Red Cross and Red Crescent movement last week was represented by the Secretary General of the Kenyan Red Cross, who actually brought us the perspective from the ground, because we here today talk about the enormous development that have been mentioned and pushed forward up to now, but we also need to look into how does that translate on the ground, and particularly in hard to reach areas and complicated areas, particularly those affected by conflict and other fragilities. I'd like to bring 4 points very, very quickly that also contributes to the discussion from a frontline humanitarian organizations such as the ICRC, but just also to give you a few numbers of what are those people, how many people are we talking about when we talk about how to reach people. My organization studied the number of people that we consider as being those hard to reach people, vulnerable. And we talk here about 66 million people present in non-state armed groups controlled areas, where people are not only in conflict settings, but also outside of all basic services outreach, in particular health services. And those are people that will need to be part of the equation when it comes to covering and coverage and ensuring the maximum impact of the COVID vaccination campaigns that are about to take place, hopefully soon. We talk here as well about the vulnerable, amongst the vulnerable, about people displaced, people in forgotten communities, people detained, but also people that will obviously fall in the cracks one way or another, and that needs to be considered and approached. Our ask is very simple. We first need an independent global allocation and distribution mechanism to ensure that those people are not left behind. Make sure that this efforts will also bring up a backup mechanism to catch these people and ensure effective global COVID-19 vaccination that excludes no one. So it's important to ensure that everyone is really considered in this global health imperative. Another point I wanted to bring here is the frontliners. The healthcare workers are not only the first, but also our last line of defense. And too often they are in a situation where they can't commit to their work and cannot be developing their response as well because of insecurity, but also because of the stigma that they carry with them. The ICRC has recorded over 650 events of direct attacks that those people have experienced. And this is a very important and worrying concern that we need to consider when it comes to delivering this service. Another point is also the importance of respecting the humanitarian principle, and particularly in conflict-affected settings. There was a mention of the Ebola response and how we learn from it and how we understand what are the shortcomings, but what also are the principle that needs to be tied to such a global, to such a health response. And one of the issues is definitely to ensure that humanitarian principle and humanitarian access, neutral, independent, and impartial, is respected as well by the arms carriers. A third point for us, a fourth point is also the intertwined needs that we mentioned, and that were raised also by the ambassador of Salvador. Here we don't talk just about the health direct impact, but also all the other impact that will also impact the resilience and bring this resilience at acceptable levels. The permanent representative El Salvador mentioned the hurricane that devastated the Central American countries, and we'll talk about 2.9 million of people affected in Honduras. That shows as well that priorities as well are in so many levels and need to be addressed in the very short term. We have studied and assessed the impact of the social and economic consequences of the response to this crisis, or the containment of it at least. And in some countries, particularly in African countries, we are very concerned about the capacity for people to really make sure that they are going forward and really addressing all their needs. When we talk, for instance, about Somalia, we realize that the children malnutrition has doubled, at least in the coverage of in our programs, and also pregnant women and young women. So that also shows that this is part of the needs that need to be addressed equally in terms of importance. So I'll just conclude with those words by saying that we really need to look this in a larger perspective and lining up all the needs that need to be considered in this particularly crucial moment where we will be part of the response. Thank you.
Thank you so much, Leticia. Fully endorsing everything you've said there. We don't get enough attention to these most vulnerable and affected people. We've now got one last panelist. It's Maria Francesca Spatolizano, who is Assistant Secretary General for Policy Coordination and Interagency Affairs at the UN. Francesca,
thank you very much, Ryan. I hope you hear and see me well.
please.
Excellencies, ladies and gentlemen.
Yes, we hear you.
Dear colleagues, I would like, first of all, to thank the EU delegation, the mission of Germany, and the missions of the EU member states for organizing this UNGA side event on the Team Europe vision and its response to COVID-19. The special session of the General Assembly last week showed that there is a growing convergence of views among member states on the response to the pandemic. And this is in itself good news, as it was far from a given in the current fragmented international arena. But possibly it is the harbinger of better things to come. Most have been said already in this panel. I agree with all the points made by the distinguished co-panelists. So on my side, I'll make just 3 points with you quickly. One is on SDGs, one on the EU, and one on the UN. First, on the SDGs, we must use our response to COVID-19 to get back on track to realize the SDGs. Felix Fernandez Shaw said it in a different way, but I think we totally agree on this. Let me note, collectively, governments around the world rolled out stimulus packages equivalent to almost 13% of the world output in 2020, which is the largest fiscal measures that the world has since the Second World War. We must make sure that these massive stimulus measures do not only support consumption and jobs and help us avoiding deep recession, which is all necessary, of course, but we must ensure that these measures, if we learn anything from this pandemic, also foster investments to build back better, to enhance resilience. And by doing so, they accelerate sustainable development. As an integral part of the recovery from COVID-19, governments need therefore to adopt transformative policies. We need to realize the 2030 agenda. This was a main message of the last week's special session. Second, the EU. The EU is leading by example on the coordinated response to COVID-19. I cannot say this enough. The General Assembly special session sent indeed another strong message that we can only overcome the pandemic and recover better through international cooperation and solidarity, as you all said already. To echo the words of Ambassador Husgen, the EU and its member states are standing at the core of the multilateral effort to combat the pandemic and its impact. Your decision to coordinate with each other and your concerted effort to rally all actors around the response to the pandemic are inspiring. And it is also exemplary, let me say, that the broader financial plans of the EU feature the environmental and climate change so prominently, because we must keep addressing those existential challenges as we respond to the pandemic. Third, the UN. The UN is responding to the pandemic on multiple fronts, as you all know. The United Nations is supporting the health and the humanitarian response to the pandemic in all countries. It is assisting countries to combat the pandemic on the ground, and the reforms of the UN development system have prepared us, we believe, to work effectively together to support a better recovery guided by the SDGs. But we are also learning from this crisis. As it was mentioned, the ACT Accelerator and the COVAX facility can inspire actions because they are so innovative, but to support developing countries in other areas as well in the near future. Looking ahead, the Secretary General has called for a new social contract, including at the UNGAs last week. Let me quote, a new social contract between people, governments, the private sector, civil society, and more can tackle the roots of inequality with fair taxation on income and wealth, universal benefits, and opportunities for all, end of quote. Those ideals should indeed be pursued as an integral part of the roadmap to recovery. In conclusion, I reiterate my praise for the leadership of the EU for taking action and for engaging with the United Nations in these efforts. The HLPF, the High-Level Political Forum in July, is one upcoming event where we will all take stock of the impact of COVID-19 on the Sustainable Development Goals and reflect together how to achieve a transformative response to the pandemic. I look forward to your participation. My department, TESA, and I stand ready to work even more closely with the EU. Thank you very much.
Thank you so much, Assistant Secretary General. And I just think they've been really great contributions. It's now time to bring in feedback and questions from the floor. We've got 6 already in, so I'm going to go through that speaking list. First, I'd like to turn to Mariangela Zappia from Italy, who are also the G20 presidency in 2021. If you're still on the line, Mariangela, please do join us now, Ambassador.
Thank you very much, Ryan. I'm on the line. I was very interested in the discussion and I followed everything. Thank you to the European Union delegation and to Germany for organizing these initiatives. And I have to say, I'm very proud that, you know, 2 women, the President of the Commission, of the European Union Commission, and the Chancellor of Germany are in the lead, and what a very difficult, challenging presidency has been, but really a strong example of human leadership. Just few words. Of course, Italy has been one of the main sponsors and promoters of a multilateral and multidimensional response to COVID-19 emergency, called since the early stages of the crisis for an international alliance to face the pandemic. We have indeed called since the beginning for a coordinated and synergic response based on cooperation, solidarity, and inclusivity. We have participated and co-hosted the Coronavirus Global Response Initiative, co-launched the ACT Accelerator, and pioneered the COVAX facility with an early contribution of more than $100 million to the Gavi Advanced Market Commitment for the access and equitable distribution of vaccine in 92 developing countries. So it's only natural, I would say, that Italy has also strongly supported since its inception the Team Europe approach, because it's about acting together. We have concretely contributed to the package of initiative with an estimated amount of more than $1 billion in intervention and programs, especially focused on the field of health assistance, emergency relief, and access to food and essential goods. Now, looking ahead, and as you said, Ryan, since December 1st, Italy holds the presidency of the G20, and we are therefore called to play, I would say, a steering role in the incoming months. Since the pandemic is far from over, we must first and foremost place the international response to COVID-19 as the prominent issue through 2021. Our goal is to promote global health as a global public good. Therefore, the first objective of our presidency will be to push for an equitable worldwide access to vaccine. And as Martin, my colleague from Kenya, said, we don't have to have any hierarchy on this. The G20 is already working on this crucial issue, in particular by promoting the implementation of the ACT Accelerator. And here I heard Bruce and from WHO, we will push for the accelerator to be really financed. We will do our best to enhance and brought it to completion. In this perspective, the presidency of the EU Commission, the President of the EU Commission and the Prime Minister of Italy will also host in probably May, we're not sure yet, a global health summit. And the scope is precisely to push for the immediate response that has to be given. At the same time, we believe it is our duty to look beyond the immediate crisis and focus on effort on fostering an inclusive, sustainable and resilient recovery. We want to put people at the center. This means tackling inequalities most of all. And we will place a particular focus on tackling gender inequality as a cross-cutting challenge. As Griselda from Salvador underlined, the challenge is not only that half of the world is affected by this, but also that half of the world has to be part of the recovery, and the recovery cannot be as strong as we need it if women are not fully involved. I don't want to take much time. We are committed to enhance cooperation with all international partners, with the UN system as a whole, and to engage all relevant actors of the civil society, the academia, the private sector. And the last thing I want to put on the floor is that Team Europe approach is an example, or is a best practice, if you want, and we might think of replicate it and looking at the recovery better phase. We look with particular interest to the possibility to implement a sort of Team Europe approach to all the initiatives carried out in the field of debt relief in support of developing countries. So this is an idea, and just to reiterate that Italy is ready to work with all to fight this challenge and to recover better. Thank you.
Thank you so much, Ambassador. I think that is going to be a message very well received by the EU's partners. And Bruce, I think you made his day with that commitment to keep working on the ACT Accelerator. So thank you again. Now time to turn to the ambassador from Mali, Ambassador Issa Konfuru. The floor is yours.
Thank you. Can you hear me? Thank you, Ryan. Thank you very much. I first would like to thank Germany and Team Europe for organizing this important meeting. I acknowledge the important introductory remark made by previous speakers. I have 2 comments to save time. The first is to concur with the previous speaker that COVID-19 is a global pandemic and that we should continue to work together to win the fight against this deadly virus. I must underline the fact that, yes, we are all affected by COVID-19, but I would like to stress particularly the specific case of countries in conflict, like Mali. We are landlocked, and we seems to be more vulnerable to this pandemic. In fact, in addition to the health impact, we are faced with the social and economic challenges COVID-19 has imposed on us. You know, Mali is a landlocked country. We do have security challenges in the country. And at the same time, these security challenges are not allowing us to collect to make fiscal collection, to give enough resources to the government to meet the basic need of the population. So, and at the same time, we need to continue to pay our debt. We need to continue to provide means and equipment to the army to protect the country and secure the population. It's not an easy task for us at all. So I would like to commend here the support of our partners in this regard, especially the EU. The second comment I would like to make is to express our gratitude to Team Europe for not only the financial support it's giving to the country. I have noted 140 million disbursed in Mali in these years, but also to commend the innovations put in place to help Mali. I know that there was a video on how the EU and our other partners are helping a group of women in Mali to start their business, to develop their business, to create more job and a more economic opportunity, not only for these people, but for the rest of the country. So I commend this effort, and I really appreciate the comment made by Mr. Fernand Chose in this regard. Hopefully, we will continue to take this example and develop it elsewhere. Thank you very much.
Thank you so much, Ambassador. We've now got, we've had 2 speakers, we've got 5 more. I think what we'll do is keep going through those bits of feedback and then come back to the panelists at the end for reactions so that we can get through all the 7. But I don't think we'll have time for any more than that. Next on the list is Latvia. So Ambassador Andraž Pilgović, we'd like to hear from you now,
yes,
please.
Thank you, Ryan. I appreciate the EU delegation and mission of Germany for organizing this side event, and I appreciate also the statements by the keynote speakers and panelists on your reflections on Team Europe's contribution to COVID-19 response. Latvia supports this Team Europe effort, and working together better is certainly our approach. Latvia has aligned its bilateral development cooperation with Team Europe priorities, namely addressing urgent issues related to COVID-19 crisis, including in the health sector and overcoming socio-economic consequences. I certainly echo with the statement by the European Commission that digital literacy is one of the priorities which we have to cover. During this crisis, we encountered multitude of challenges, not just in the areas of cooperation, but also in how we work together. And during this very practical nature of COVID-19 restrictions, Latvia's experience has been that the crisis has demanded ever greater reliance on our local partners, organizations, including civil society organizations. Local partners have first-hand knowledge and understanding of evolving situation and needs of those most affected and most vulnerable. In a crisis where we have to deal with the deluge of misinformation and disinformation, and where the key ingredient of effective response is having public trust, engagement with civil society organizations and other stakeholders can help governments to be more effective, to reach more people and those firsthand which need most of our support. I think Egri from El Salvador mentioned some examples of the national perspective, but my question is, what other lessons on stakeholder engagement and partner countries can be drawn from Team Europe experience so far, and what challenges or innovations have arisen, especially taking into account the necessity to respond quickly? I thank you again.
Thank you so much, Ambassador. Now it's time to turn to the Deputy Permanent Representative of Dominican Republic, Joan Sedano.
Thank you, Ryan. Thank you for the opportunity to address this distinguished panel and participants. It has been very interesting to hear And we do agree with what has been said already. I also had a question regarding platforms to lessons learned, how we can together reflect on what we have learned from this whole experience. But so far, I think that there are at least 4 elements of those lessons learned. One is certainly the importance of multilateralism. I think we all agree on the importance of and the role that multilateralism plays while addressing such difficult circumstances. The key importance of leadership and the importance of joining forces together and enhancing positive leadership. Another one is solidarity. And I think it speaks to what Leticia was saying. There are so many vulnerable populations out there that are not under government control areas and are subject to armed groups. 66 million people, hard to reach in terms of vaccine, in terms of treatment, and you name it. And finally, the need for a sustainable recovery has been widely mentioned here, and we totally agree on revisiting the financing for development strategies. Investments will be key while we start our efforts to economic recovery, and of course resilience with the people at the center, as our colleague from Italy already mentioned. From the DR, we are thankful, very thankful to the European Union and its member states for their partnership in responding to the pandemic in the Dominican Republic. Right after the declaration of emergency, the European Union was the first one to say present and to redirect funding and developing strategy to increase the capacities of the Dominican Republic in responding to the pandemic. So just wanted to share that, and thank you, Ryan, again.
Thank you, Ambassador. Oh, sorry, Deputy Permanent Representative. Now we turn to Cabo Verde and Ambassador Roca. The floor is yours.
Thank you very much, Mr. Ryan. Let me first thank all organizers of this present meeting. Greetings to all participants and panelists. Let me also commend Team Europe for its global and multilateral approach. I can add, as Joanne said, leadership, solidarity are also important. As we speak about COVID-19 pandemic, I believe we all share 3 major imperatives. The first one is about, since we are moving already 10 months in this pandemic, and until we don't have it behind us, we must keep a permanent sense of urgency in order to improve the health capacity response in many developing countries, including equitable access to a vaccine. My country has a national plan for vaccination, and we are discussing with our partners, including this COVAX, in order to get in due time and a coverage of our population in this context. But the focus here regarding the health emergency is access and deliver in a very inclusive manner. But we must, that's the second point, we should keep in mind that we must go also at the same time beyond health concern to address in a bold strategy how to tackle the social and economic impacts, specific in countries that are going through a major and disruptive impact on the COVID. Take the small island developing states like mine, where the major economic drivers like tourism, air transportation, internal demand are totally locked down with unemployment and the need to bring support. Then how concretely we can respond, recover, and build back better, greener in this context. Here, the focus is assess, and coordinate better. Not only the responsibility of the countries to have their own plan of response, but also a coordinated approach by international community in order to help countries that have little resources to navigate in this very big landscape and then in order to address and to avoid setbacks and painful traps. And the third remark I will conclude by there, it's about funding. This is the third imperative. It's not about business as usual. It's not about long delays in bureaucratics to approve funding and to disburse them. The focus here is how to assess and to assure fast-track liquidity. In order, we need a real breakthrough against business as usual. I must say that we need to work like to bring a global funding insurance, where, in other hands, instead of a deductible, we should have a kind of equal benefit as a basis for all countries. And then we can add a second tier when in a proportional criteria to address a differentiation needs for countries. We must bring together these three imperatives, these three issues. And I thank Team Europe to think about that in a global perspective, in a multilateral way, but also in an inclusive way to all countries, especially those most vulnerable and most needed countries. Thank you very much.
Thank you, Ambassador. And that's a very important reminder. We didn't get into it in a lot of detail so far in the discussion, but the need to build back greener. It's also going to be on our mind at the Global Climate Ambition Summit on the weekend, and the EU has certainly been integrating that into its broader pandemic response. We've now got two final reflections from the Deputy Permanent Representative Hussein of Bangladesh, and then we'll turn to South Africa before coming back to the panelists. DPR Hussein, it's over to you.
Yeah. Thank you, Ryan, for the opportunity. Let me begin by thanking the organizers, Germany and Team Europe, for this very important event. We actually came to know many things about what Team Europe is doing around the world. So I will make some two quick comments and questions, in the interest of time. Let me first also join my previous speakers in appreciating the Team Europe for their COVID-19 response, especially for the support to ACTA, COVAX, and CEPI. So my first question and comments will be like, everybody is saying that COVID-19 vaccine will be a global public good, but how Team Europe will be coordinating the support that they are planning to provide for the COVID-19 procurement and supply to the developing countries, especially countries in Asia and Europe? Because some are apprehending that because we know that vaccines are produced by very specific particular companies, and there is an apprehension that the developed countries from the developed segment of the world is coordinating with them bilaterally to procure the vaccines. So in that case, how Team Europe is planning to to procure and supply through COVAX facilities to the developing countries? That is number one. And number two would be like, that there are some countries, including ours, where the trade disruptions has had tremendous impact on the economic situation in the country. For example, in Bangladesh, vis-a-vis European countries, with the countries in the Europe, we have like exportables of 2 or 3 items. For example, the garments, apparels, and also the frozen food. So in that case, these trade disruptions actually is taking a big toll on our economy, on our people. And we know that the Team Europe has a commitment of like building back better. So in that case, do they have any particular or specific measures for the LDC countries or for the graduating country like Bangladesh to support their post-COVID economic recovery? I thank you, Ryan.
Excellent. I'll make sure that Felix responds first to those questions in just a minute. Now, finally, Deputy Permanent Representative Shaliso Mahongo, over to you.
Thank you very much. And we wish to congratulate Team Europe for this very excellent event today. Early this year, a few months after South Africa took over the chairmanship of the AU for 2020, through President Ramaphosa, we found ourselves thrust into the role of leading the African continental efforts on COVID-19. And of course, Team Europe was one of the first and very early supporters of the African Union efforts against COVID. And we really appreciate that. I wanted to make that statement on behalf of the chairman of the African Union. I just have one question, and it relates to the green recovery. And my question is, how does Team Europe, in its international relations, plan to implement the green recovery? In other words, what will you be expecting from your partners in this regard? I thank you very much.
Wonderful. Thank you, Ambassador. Okay, so what I think we should do next is I'll turn to Felix first among the panelists, because we have that very specific question about green recovery partnerships, and then also how Team Europe plans to manage or be part of the supply chain management around COVAX so that there is equity in practice, not just in theory, and so on. And then I'll allow everyone to give a final reflection. We've got enough for about 2 minutes from each of the panelists. So Felix, if you're ready to go first, I'll now hand over to you.
Thank you, Ryan. And I think in response to Ambassador Hussein from Bangladesh, I would say that we're not planning, we're not planning any way out. We're only planning to reinforce our partnership with Bangladesh and with other countries in the world, but specifically with Bangladesh, in the sense of promoting the recovery and working better together in Team Europe to support Bangladesh in its recovery from COVID-19. We're just starting the programming process. And also to reply to the South African ambassador, we are reaching out the EU delegation in your country and the different member states, embassies that are present. We are reaching out, and the conversation right now that we're putting on the table to you is, what do you want us to do? Where can we help? Where can Team Europe deliver efficiently? Where can it deliver transformational impact for its support? Where do you need that kind of help? And I can tell you that, for example, in South Africa, we're working very closely, I think, on the Green Deal and the transformation and the transition of South Africa towards a zero carbon economy, which is one of the demands that we got from the South African government. I think also in reply to the distribution chain of vaccines, we're working very closely with the World Health Organization, but also with ACTA to try and bring all these issues together. And this is one of the, I think, next elements of operationalization of Team Europe that we're going to have to secure very quickly. Also, as was requested by Ambassador Kimani at the beginning from Kenya. I don't have the specific details. One, when does multilateralism also knows some of the details, but not all. But what I have seen in the making is a very interesting Team Europe kind of initiative to be able to deploy the vaccine quickly and to support its operationalization. Thanks.
My system is not agreeing with me there. I think I've sorted that now. Thanks, Felix. And I think maybe if we work backwards in the order that we heard the panelists from in the beginning to operate in fairness, Maria Francesca, do you have any reflections and reactions to the questions and comments that we've just had in the last part of the session?
Thank you very much. I don't have any specific answer to the extent that questions were not directed to us in the UN, but I certainly would like to reiterate how well we work with the EU and with all the member states, and to highlight maybe for all the member states that the UN is indeed the place for the cooperation and the solidarity. Looking ahead in the next 75 or even more years to come, we need a strong multilateral system, and that's the UN, thanks to these renewed lessons, if you want, that we learned through this unfortunate Did you hear anything of what I said? Yes? Okay, good. Thank you.
Okay, now I think we'll turn to Laetitia Courtois. Bruce Elwood from the WHO has had to jump off, so we will try and bring him back in if he joins in the next couple of minutes. But for now, Laetitia, over to you.
Thank you very much, Ryan, and thank you very much for this very insightful and very useful discussion. I just would like to bring just a few comments in terms of access and delivery. I think it's not far away when we actually had to discuss and to raise the concern about accessing to protective equipment not so long ago at the beginning of the pandemic, and I think it also is somehow familiar to the next challenge, which will be accessing the markets and accessing what's needed for the people on the ground as well to be able to deliver and particularly the health services in the complicated areas. I think it's beyond the logistical pipelines that we often discuss. It's also about accessing the markets and being able to purchase the needs, the material that will allow for the delivery. So I just wanted to mention that, and also mention that often this last mile, it's not necessarily a material question. It's also a matter of being given the access, being granted the trust as well to be able to access some population in complicated areas, and being able to as well be respected for that, because it's something that is recognized as a key element. I would also really very much thank the intervention that mentioned the climate shock as a key element, and the discussion around the green aspect of Team Europe. But it is true that we are here talking about overlapping shocks and needs for people, and this is also when we talk to people on the directly in more sensitive areas. This is also often the primary need they express. They will not necessarily talk about the access to vaccine, but actually how to access to shrinking resources, and that means as simple as accessing markets or crops that are just disappearing and not available anymore. So this is also the reality that we need to be really much keeping in mind. Although the vaccine is a priority right now for a number of states, and this is the solidarity here is really remarkable. We also need to put that into the perspective of the priority needs that people will express as well, based on their own reality on a daily basis. Thank you very much.
Thank you so much. And how extraordinary. With 1 minute to go, we're down to our final speaker. We've done it. We've stuck to the schedule. Ambassador Kamani, if you have any final thoughts, please share them now. We might have lost Ambassador Kamani of Kenya. Then I will actually also ask, I'm sorry, Ambassador Lopez from El Salvador. I should have done that. I apologize greatly.
That's fine, Ryan, that's fine. Thank you. Well, I just want to make two quick comments regarding what was asked by Ambassador Andrej from Latvia about what other lessons can be drawn from the pandemic and what had been like some of the challenges, but innovations and in order to respond quickly. And I guess that I will mention very briefly about one of the initiatives carried out by the Salvadoran government As you know, the COVID-19 pandemic has required to adapting our activities to virtual platforms such as this one that we're having now. And in that sense, we established a telemedicine service under the leadership of the Office of the First Lady, Gabriela de Bukele, with the collaboration of UNFPA and the Government of Canada. And this is providing medicine services and some advices, for instance, to pregnant women, new mothers, those that are fathers and mothers of young children, and people that are in need of mental health support. And this initiative has allowed us to ensure continuity in the provision of health services, which is key all the times, but especially at this moment. And finally, I guess that I completely agree what was mentioned by the Dominican Republic representative about spaces where we can share lessons learned and also good practices to fight and prevent COVID, but also looking into recovery initiatives. And I guess that's why events like this ones, this is space by Team Europe, has allow us to precisely share what we are doing and also what we can do and how we can come together to work even stronger. Thank you, Ryan.
Thank you so much, Ambassador. Now, just to wrap it up very quickly, I think what we've certainly heard from this event is a huge amount of political will. And while the logistic challenges of dealing with the vaccine are incredible, you really can't get anywhere in life without political will and the mindset of solidarity. And we've certainly seen that during the discussion today, which makes all of the rest of it possible. So thank you to our Team Europe organizers for this event, the EU and the German presidency of the EU. And I wish you well for the rest of your days and week. Thank you.
Thank you.
Thank you, Ryan. Well done. Very well done. On time.
Thank you. Thank you, Christoph. Thank you, Ryan.
Ryan, very German.
I take it as a compliment. Thank you.
Yes.
Thank you, Ryan. Thank you all.
Everyone. Thank you, everyone.
Thank you, Ryan.